All of us talk about the asbestos and the biochemical hazards in this area, so we want to get you updated and informed on what you need to know this morning. Joining us now on the phone, Dr. Bruce Hirsch from the Northwell Health system. You are an infectious disease specialist, so good morning to you.
Good morning.
So let's first start with, I don't want to be fear-mongering, but we've heard about the debris falling on people. Bag your clothing, take a shower. How alarmed should people be, and what are the protections they need to know about?
There's a tremendous amount of particulate matter in the air right now. And we ask that everyone stay away and avoid that area. Respect the sidewalk closings. Don't allow yourself to be exposed to high concentrations of dust, irritants, and possible toxins. If you're near the area, I do recommend breathing through a handkerchief or through a cloth to reduce that area, and to monitor your breathing, to monitor how you feel, whether or not you have cough, shortness of breath. This will be a problem for people who have underlying lung disease, and they should check in with their physicians if they have any discomfort.
When we talk about the air quality and the air quality testing that's going to be done in the near future, how long does it take to do that kind of air quality testing, and the masks that people should be wearing? We see the first responders right now putting on these white masks. What do people need to know to protect themselves if they are outside right now?
It's unclear to me how long this area will be dangerous. Depending on wind, depending on the duration of the incident. Hopefully this will come under control promptly. But people need to be cautious and listen to news sources such as yourself to be able to understand the continued risk over time. In the meantime, stay away.
Dr. Hirsch, we're constantly warned about asbestos, but tell us the dangers. I know you just read off some symptoms, but talk to us about when they could take impact this could have on our body.
Impact takes place over sprints. After exposure, some individuals who are vulnerable will have wheezing, cough, shortness of breath. Over the next couple of days, people may have irritation, and because of the inflammation in their airways, may develop secondary infections. Asbestos is a long-term health risk, and if there's exposure to tremendous amounts of asbestos, there's a slight increased risk of lung damage and tumors over the next couple of months and years.
Wow.
And, we know that this labyrinth under the city is more than 100 years old. It's a cable of tunnels and pipes that we don't know much about, put in so long ago. Aside from asbestos, what should we be worrying about?
I'm concerned about dirt and particulate matter. The heat of the explosion will sterilize any infectious risks short term, although after inflammation, vulnerable airways will be more vulnerable to infection.
Dr. Hirsch, we appreciate you joining us. Good insight and information for our viewers out there.